Hello, my name is Nicholas Deschamps, and this is a newborn infant exam. I'm going to start off with hand washing, and I'll introduce myself to the patient. Knock, knock. Hello, Emmett. Congrats on your new daughter here, Molly. Yes, I'm very excited for you. I'm a nurse practitioner student. I'm here to do examination of your newborn. Would now be an okay time for you? Okay, perfect, perfect. You just finished breastfeeding. Very good. Well, we'll go ahead and do the exam. Please feel free to stay with us while I'm doing the exam here. You say, hello there. Oh, you are so cute. You look exactly like mom. Okay, Molly. Well, as I begin to examine this newborn, I'm taking a general appearance in. I'm unswaddling the child here. Good, good. Let me get that out of the way. I'm looking at the skin tone and the overall appearance. I don't notice any cyanosis. The baby looks like she's breathing normally. So all this looks very well. We're going to be getting a head-to-toe assessment on her. I'm going to be starting up at the head. And I'm looking for any bruising, any cuts or scrapes. I'm looking for the shape of the head. I'm feeling the anterior and posterior fontanelles, which both feel open still. Good. And the head seems to be of a normal shape. Don't notice any cuts or abrasions. At this point, it'll also be good to measure the circumference of the head here. Let's see. So I'm going to measure just above the eyebrows. Let's see. She has a lot of hair for a newborn. Okay, good, good. And then we'll measure the length. The bassinet she's in will give me the weight already. Okay, very good. So now that I have a head circumference and a length and a weight, I'm going to plot them on the growth charts, and I'll make sure that everything looks normal there. I'm looking at the level of the ears next. So the ears look like the top of the ears in level with the eye, so they're not low set. The crus and the helix do seem well formed. Let me see. Okay, good, good. Don't notice any problems with the ears, and they do appear to be on an appropriate axis, not turned in or anything. That's great. Next, I'm looking at the eyes. The eyes do seem symmetric, and they seem very horizontal. I'm going to be assessing the red reflex. Let me turn on my ophthalmoscope. I'm going to show you guys here. So, boom. Yes, I see the red look. Both of the retinas appear red. They don't look white or anything. So I'm not concerned for retinoblastoma. I'm going to be looking up the nose at this point too. Okay, the nares look patent as far as I can see. This would be a good time for me to ask the mom, hey, does this newborn have any problems, like heavy breathing when they're feeding, which could be indicated of like a choanal atresia or stenosis. But the mom says that they've noticed no noisy breathing. Okay, good, good. So moving forwards, I want to take a look inside the mouth. I'm going to take a look. I want to make sure there's no ankylglossia, that the tongue's not tied, and I can see back there. I'm getting a pretty good view of the hard palate. The hard palate looks normal. The soft palate, it can be hard to tell if there's the cleft in there. So I'm actually going to take a gloved finger and I'm going to insert it into the child's mouth. I'm going to feel the hard and the soft palate. Make sure I don't feel any cleft. Okay. And while I'm doing this as well, there'll be the child will suck on the finger. That's a normal reflex. Okay, very good. I'm looking for any teeth yet, and I do not notice any. Okay, very good. So moving onwards, I'm going to inspect the neck. I want to make sure that there's no extra folds of skin back behind the neck here. Good. I also want to make sure that I'm going to look to see if there's webbing of the neck, which could be indicative of genetic disorders, which I do not appreciate any. I'm going to feel alongside the collarbones, making sure that there's no step-offs or deformities. Okay, good. I do not notice any breaks in the collarbone. Moving down, I'm going to look at the way the chest looks. I want to make sure that it's normal, that it's not concave or convex, which can be a common childhood problem. I don't think this shirt comes off, so we're going to pretend that this is all disrobed. Oh, here we go. Okay, good, good. Okay, so the chest looks very normal. Next, I want to listen to the heart. So we're going to listen just like we would an adult in all of the all of our landmarks. The for a child, an infant, the normal rate is 120 to 160, so it can beat quite quickly. Let's take a quick look here. Listen here. Good job, good job. Just gonna try and reassure the child as I'm listening, and I gotta help rub the head, help relax them while we're listening here. Oh, you are so cute, little baby. Good, doing good. Now, some murmurs might be normal for children to have. I'm not appreciating any murmurs on this exam. Good, good. Almost done. Okay, very good. And now that we've listened to our heart, we're going to be listening to our lungs next. Going to be listening on the front and the back. So let's start off listening on the front here. Good. Normal breath rate is 30 to 60, so they're also breathing quite quickly here. Very good. I'm going to support the baby. We're going to sit up a little bit. I'm going to listen on the back side here too. Same thing as an adult, I'm doing bilateral for comparison, so I can see what one side sounds like, what the other side sounds like. Okay, good. I don't notice any adventitious breath sounds. Next, I'm beginning an inspection of the abdomen. I see the umbilical cord. It can be pretty normal for children to have umbilical hernias. If they do, I want to see if it's reducible or if it's incarcerated. So she does have a little one, but as I push down, I'm able to push that hernia back in place. Okay, very good. I'm going to be palpating the stomach, or let me actually listen see if I can hear any bowel sounds. Okay, her bowels sound normal, active. I'm going to be feeling for any masses now with palpation, and I'm going to be paying special attention to the border of that liver on the right upper quadrant. I might be able to just barely feel that liver, but I shouldn't be able to feel it protruding too far past. Good. So abdomen looks normal besides the hernia, but it is reducible. So moving down to our hips and legs, I'm going to want to palpate our femoral pulses. Let me see here. Okay, good. I feel it on the left side, and let's make sure we feel it on the right side as well. Okay, that's very good. Now we're going to do the Barlow and Ortolani's. I'm going to lift up our legs here. This might be hard to do. So flex the knees to 90, and I'm going to rotate inwards, adduct it, and then bend down. Okay, good. And now keeping them at 90 degrees, I'm going to rotate outwards. Okay, good. We'll do the same thing for this side. And I'm trying to feel for any clicks or thuds that could be a sign of the leg dislocating down, and then we'll do out. Good, and I don't appreciate any of that, so I don't suspect any hip dysplasia. I'm going to move on to our genital assessment here. Okay, I'm looking, the labia might be a little bit swollen from mom's hormones. That's quite normal, but everything else looks normal. I don't notice any spots or anything that looks abnormal, so that's good. Moving on to our extremities, let me see if I can feel any pedal pulses. Okay, good. Radial pulses. Okay, very good. Moving on to the back now. We're going to turn the baby over and take a good look at our back side. Here we go. So on the back, I'm looking for, there could be normal birthmarks, like bluish, grayish. There can also be rashes, so I want to make sure I don't notice any rashes, which I do not. I also want to look at that gluteal cleft. I want to make sure that there's no hair patch back here either, which could be indicative of other disorders. Our backside looks very good. Don't see any problems there. So I'll also want to do a neuro assessment here. We'll want to check our palmar grasp. So I'll put my finger here, and those hands will curl instinctively around my finger on both sides. Good, good. I'm going to test a rooting reflex here. I'm going to touch the side of the cheek, and the baby's head is going to turn towards the side touch. Do it on the other side here. Okay, very good. Let me test our Moro reflex, and we'll also test our extremity strength. So I'm going to pull up the baby by the hands here, and I'm going to drop the baby into my hand, and the arms go back and then back up. So that's our Moro reflex. When I'm pulling on the baby's arms, I notice a good strength. Same thing with our legs. I notice a good strength as well. So this will be wrapping up our newborn exam. I'm very pleased with how well this exam has gone. Obviously, this went a little bit quicker than it would if I had a real baby here, because this baby is very compliant. So I just wanted to now take the time to reassure the mom, Emmett, hey Emmett, just wanted to let you know everything on the new baby exam looked very good. I'd inform her that I found a little bit of the umbilical hernia, but that's a very normal finding after birth, and that it is reducible, so it shouldn't give us any problems. Yeah, this is a very healthy baby, and I would also take time to stress the importance of following vaccination schedules to protect your baby, and maintaining those regular appointments with the pediatrician so that we can plot the growth charts and do our milestones, so we make sure that she's not falling behind in anything. Before I hand her back to mom, I'll go ahead and re-swaddle the baby. Okay, here we go. Make sure she's nice and comfortable. So we'll do this side, we'll do this side, and then we'll do this side. There we go. Okay, Molly, you are so cute. You rest up. I know that was a big examination. Thank you for letting me check you out. And Mom, thank you so much for letting me check out your baby. I really appreciate it. Here is the baby back to you. So I hand the baby back to Mom. Okay. And then I also want to just make sure that Mom has no unanswered questions. Mom, do you have any concerns or questions for me? I think it's very common at this time. The mom might say, yeah, I'm having some pain while breastfeeding, and so I could set her up with the lactation consultant so that she could get advice on how to improve her lactation. Okay, well, thank you guys for watching this newborn assessment. That will conclude this examination, and thank you to my my lovely model here. Okay. Gosh, I think I got this when I was like 3 years old. It was like 27 years ago. Oh my goodness. Never thought I'd be using this again, but it's been great. Okay, thank you.